Okay, let's move on to healthy families. So this is a separate module that is done alongside timed and targeted counselling, which brings the village health worker up to speed with all the other elements outside of the maternal and child health aspects to bring a whole of life approach to community health care. The Healthy Families module was originally written in Ghana as a collaboration between World Vision International and the Ministry of Health of Ghana and Ghana Health Services. In particular, the following documents were used in its composition, so the Millennium Villages Project Community Health Worker Training Manual, the Ghana Family Health Service Maternal and Newborn Care Module, and Timed and Targeted Counselling 2nd edition from World Vision International. In Lesotho, it has been adopted and adapted for use by the Ministry of Health, including contributions from the following individuals and organisations. Healthy Families is still quite a new concept as it was launched in Ghana 2 years ago and is yet to be evaluated in an impact trial. However, since its inception, it has been adopted by a further 5 countries for use in their national programme, and this is predominantly due to the simplicity of its approach in bringing together many disparate elements in an integrated service delivery system. So let's open our modules now and have a look firstly at the objectives of the module. So what are we trying to teach village health workers through the training of this module? First of all, it's giving a really solid basis and grounding on community health care and what is its importance. We talk about the roles and functions of the village health workers in their community health activities, how to mobilise and organise community members to conduct community health activities, and to provide routine household care for children aged 2 to 5. Remembering that children under the age of 2 are covered in the timed and targeted counselling module. By the end of this module, they should be competent to conduct a routine household assessment and a family health check. The family health check promotes essential health actions for all age cohorts from the age of 2 to elderly care and even palliative care. They should be able to compile and maintain a community register and community chalkboard covering the major topics of healthy families. They should be able to complete and interpret a referral and counter-referral note. And also they should be able to compile a report on community births, deaths, basic disease surveillance and their monthly activities. What competencies are going to be important in healthy families? First and foremost, we are looking at the promotion of good communication skills, especially those related to negotiation and dialogue counselling. We want to teach them how to conduct a comprehensive household assessment to identify and discuss the problems of household sanitation, hygiene and nutrition. They should be able to demonstrate the technique for negotiation in mobilising households to access services, complete a referral note and compile and update the register. Typically, this should be done over a period of 2 weeks. So we're talking about 6 to 7 days in a classroom training and up to 4 days in the field practicum. The field practicum cannot be missed, as this is really important for village health workers to consolidate their learning. It doesn't have to be done separately from the classroom training. In fact, it's better if you can organise for household visits to be done close to the training venue so that they can do this together during the training itself. So successful completion of a supervision involves a supervisor observing VHWs and completed the following steps. So first one, they should have profiled their entire catchment area and mapped it. Secondly, they should have conducted community registration and household assessments of all of the homes within their catchment area at least once. Through observation and accompaniment of a supervisor into a household, they should demonstrate the correct procedure of the household and family health assessments. And lastly, they should have completed a monthly report correctly. Once they have completed all of those things, they can then progress to be taught timed and targeted counselling. The following is the service package for healthy families. So as you can see, this is a large module, but this can be broken down into 4 different services. So the first service is the community surveillance. Community surveillance involves mapping the community and identifying resources, registering deaths and also births, conducting basic disease surveillance and responding appropriately to notifiable diseases, and doing a systematic household assessment, including the identification of any households that have particular vulnerabilities, or what we'd like to call priority households. The second service package is the household assessment. So this is just looking at the infrastructure and the resources of the home and the living conditions. So in that household assessment, we are looking at hygienic sanitation and waste disposal, safe water access and storage and making water safe to drink, safe food preparation and storage, personal hygiene practices such as hand washing, the access to hand washing stations and soap, and also good practices for the family nutrition and ensuring household food security. The family health check includes addressing all the essential health actions for each age cohort in the household, starting from 2 to 5, and then we have different health actions for each of the children and young people age groups of 6 to 9, 10 to 14 and 15 to 19 years old. We'll provide parental and adolescent education on sexual reproductive health, especially for the 15 to 19-year-olds. For all adults, we will promote the prevention of HIV and other STIs and screening for TB as needed. We will refer all sexually active adults for family planning services. And with respect to care of the elderly, we promote regular health checks and home-based support, as well as identifying particular needs they have, such as chronic diseases and disability. The fourth service package is community-based care for health conditions. So bearing in mind that ICCM is covered separately in the time-targeted counselling module, in this first module of healthy families, we'll be looking at first aid and responding to medical emergencies. We also include rape care. They will also be trained on the basic concepts of non-communicable disease management and concepts around mental health and disability for community-based support. So let's start to work together through the first half of the module, which I'll be talking about over the next half an hour or so. It's important that you pause the video at different periods so that you reflect on the content as you need to. So working through Unit 1, the first session 1, is the functions and roles of a village health worker. This is really just a basic snapshot of the type of services that a village health worker will be doing in the community, what they look like and how they come together. So the first 4 activities on the list, community mapping, disease surveillance, household registration and birth registration, are all captured during Unit 1, with the disease surveillance aspect is captured in Unit 6. So typically the household registration is done during the integrated household visits as well, and they can be updated every 6 months. The routine household visit is the main activity of healthy families and comprises 2 components, which is the household assessment and the family health check. So those are captured in Units 3 to 5, looking at environmental health, health for the whole family, and sexual and reproductive health. The community-based care aspects are captured in Unit 6. Session 2 captures the values and ethics of community health work, and it's worth taking time to understand the components that we are discussing in this session. The session culminates in the creation of a village health worker charter. This can be viewed as a form of vision statement which promotes common values amongst village health workers. This serves as a commitment by the village health worker to the community members, so where possible the charter should be printed and put in a place where it's visible for all community members to see. It's really important to have a vision statement and to have some sort of agreement about what will be done and steps that will be taken if those values are not upheld. For example, if there is theft or sale of medicines, refusal to provide care or preferential care to certain families, or any abusive behaviour or failure to respect confidentiality and dignity of the client. What I would like you to do now is to pause the video and start to go through the session systematically. I would like you to do activities 1 and 2. We've listed some ideas about positive behaviours and negative behaviours that can be observed in health workers, but you can add to those as you go through as well. And then try out activity 2, so role play some of the negative behaviours and some of the positive behaviours. For activity 3, I need you to go through all of the values systematically, because each value statement is associated with particular observable behaviours that village health workers need to know about. Although you won't have time to do role plays about every single one of these behaviours, I think it would be useful to choose 1 or 2 and demonstrate them through a role play, imagining that you'll be demonstrating this for village health workers in a training setting. So let's go systematically through the charter statements. So the first vision statement is we are accountable. Accountability is about making sure that you can answer for your actions or omissions. What kind of behaviours do we observe in practice when a person is accountable? Firstly, they will seek help when they struggle. They'll be honest about what they are doing and why with clients. They're open-minded and listen to client realities. In terms of their data, they will submit their reports on time and share that performance data openly. In terms of stock control, they will be controlled very carefully, reported accurately, and never sold or given away. If mistakes are made, they should be admitted to quickly and help to be sought from others. They should tell the truth at all times and be honest about their needs and limitations. Vision Statement 2, we are respectful. So what does being respectful look like? Well, it can be related to the behaviour when dealing with clients, but it's also about respecting privacy, dignity, rights, and upholding the health and well-being of people at all times. We must respect people's rights to confidentiality and to make informed choices for themselves about their own healthcare without forcing them into something that they're not comfortable with. So, respectful behaviour from a village health worker, how does it look like? They will introduce themselves to their clients. They should call their clients by their name. They should be positive, helpful and polite. Make eye contact, use simple language and confirm the understanding of the family. Speak always in a calm and respectful tone of voice and listen actively when they're talking. You should never talk about what happens between a village health worker and a family with any other person other than your supervisor, and certainly never share information in the wider community. You must respect people's rights to make their own decisions at all times. We can provide them options and information, but person-centred care approach means that each individual has the right to decide. Number 3, village health workers are compassionate. Compassionate care is about good communication and dignity for clients and families. They should never be judged, criticised, admonished or blamed for anything. And it's also about leading with our hearts and reaching out to people in difficult circumstances. Behaviours of the compassionate village health worker: firstly, they will look for signs of fear, anger, stress, fatigue or pain. Allow clients to speak openly and to express their feelings. Always show empathy and understanding and being kind. If they take positive actions for their health, they should be praised and encouraged, and if they are worried, they should be reassured. Village health workers empower others is the fourth vision statement. It's really important that the negotiation and dialogue technique is around empowerment of people to change their own health behaviours. So village health workers have to move away from the typical technique of lecturing and advice giving. They should always listen to people and try to conduct barriers analysis to identify the root causes for health problems in the home. Vision Statement 4 is about promoting health for all, excluding none. So here we're talking about the issues of equity and equality. Equality is the easiest to understand because it is rooted in the lack of prejudice or stigma. It's about treating genders and races equally and to never differentiate or discriminate on the basis of tribe, ethnicity or religion. Equity, however, is a little bit more complex. It means making sure that all families and individuals have equal access to healthcare. So that means that a village health worker will probably need to spend more time with the most isolated, vulnerable, poorest families, and also with those who are infirm, disabled or elderly. In terms of behaviours, they should spend more time with vulnerable homes, never turn anyone away, and never give preferential care to certain groups of individuals. And the last one is just about doing the best in all that you do. So making sure that you attend supervisions and meetings, understand your training and materials, look for mentoring opportunities, follow the recommended practices, and provide care with good quality. We found that a vision statement approach to ethics and is better than a code of conduct. A code of conduct really does imply some sort of formal written agreement, but in the case of volunteers, having an empowering vision statement is much more appropriate. Okay, let's move on to session 3. So most of session 3 should not be completely unfamiliar to you, as you've done similar activities related to mapping and profiling before. So what's really important is that you take a look at the registers associated with community profiling and understand all the different components. So typically village health workers would have completed some process of community entry before the training or when they were recruited, especially if you've got new recruits. Community entry means sitting down with community leaders and briefing them on the activities that are going to take place over the next few months whilst introducing healthy families. However, this can also be done immediately after the Healthy Families training has been completed when the village health workers return to community. They need to engage community leaders in the catchment area profiling and community mapping activities. They will need to capture all of this data for their catchment area. So that means that if there are multiple village health workers working within a community, they need to define the different zones that they are responsible for and to map all of the areas and resources available within that catchment area. So they will need to do this with assistance from their supervisors, from health authority representatives from the health facilities, and also with community leaders and other members of the community. So in terms of your activities now, what I would like you to do is to pause the recording and to review the session. You will see that most of the concepts are familiar. Okay. Now look at the profile of a village health worker catchment area and discuss the following 3 questions. First question, who would the village health worker need to help them get this information? Secondly, how would they define their catchment area? And thirdly, what additional support do they need? When you're ready, progress to the next session. Session 4 is quite new content related to engaging men in community health. So the design of this session is firstly to think through what do village health workers know about the ways that men can contribute to the health of their families and of their children. It also helps us to challenge some of those preconceived ideas and social or cultural norms that we have around gender that prevent men from getting involved. The focus of this activity is to ensure that village health workers are going to try and engage men in community health. So some specific activities are about helping families to access family planning, HIV testing and birth support. So by birth support I mean husbands or fathers actually accompanying the woman to the health facility to deliver. But men should also participate with their partners in family planning and always have HIV testing alongside. Village health workers should ensure that they conduct household visits during a time that is convenient to fathers so that they are able to get involved. Throughout TTC, we'll be encouraging fathers to play and communicate with their children and to participate in family health. We will broker the engagement of fathers, especially if there is separation or divorce, so try to reconnect the father to child health activities even in the event that they're living in another place. And also, village health workers should be encouraged to conduct fathers groups using some of the storytelling approaches that are used in TTC or Healthy Families, which are really helpful for helping men to understand the positive roles that they can play. The most important activity in Healthy Families module is the household assessment, and I will say this, there is no point conducting a routine household assessment if the father is not there. The assessment of the household resources and the assessment of the family health practices is fundamentally directed towards the head of the household. Husbands are the ones that are going to make critical decisions about financial spending, about construction of resources like hand washing stations, latrines. They're also involved in waste disposal and sanitation. So it's more important that the husband or father is there than the mother. What I'd like you to do now is to pause the DVD and conduct activities 4 and 5. So these are some good activities that help us to challenge some of our myths and beliefs around men, and to also identify what are the contributions that men make to the health and well-being of their families. Then I want you to discuss the following 2 questions and report out in groups. Firstly, what are the barriers to male involvement in Lesotho? Secondly, what should village health workers do differently to ensure that men are getting involved? When you're ready, progress the video. Let's move on to session 5. So session 5 brings together a lot of these concepts in conducting the household registration. The purpose of a household registration is to collect all the basic information about households in the village health workers catchment area, so as to understand and map the health needs of the entire community. The scope of the household registration is considerably larger than any previous household registration that have taken place in Lesotho by village health workers. So it's really important that you understand the different practices we're going to do now. So the registration is going to cover 3 major areas. The first one, we already have information, which is the details of all the members of the household. Second is related to the household practices in terms of health and nutrition. And thirdly, an assessment of the vulnerability or needs of the household specifically. For the purposes of understanding, a household member is any person who is living in the house for over 6 months and is not a visitor or guest. So we may find that in rural communities lots of people relocate temporarily, are quite mobile, so they should be included in the household registration, but any person that is visiting for just a month or 2 months should not be included. So the household registration process is part of the basic service package of village health workers. They have to cover every single household in their catchment area, and they should make sure that they are going to update the register every 3 to 6 months. So this can be done systematically in the first instance, as it will take quite a lot of time. But once they've got the basic register set up, then they can do the update visits alongside their integrated household visit. So in terms of training activities, what I would like you to do is to review the form and think through how these are going to be collected, these data. When you are covering Unit 7, Session 1, that's the practicum, you'll learn about how to use the job aid and counselling cards to conduct this activity. It's impossible to simulate the household assessment in the classroom. Believe me, I've tried. So what you really need to do is set up a community practicum together as trainers when you return to the districts. When you train village health workers, the practical demonstration of this activity is going to be the most valuable learning activity for village health workers. So it's advised that you identify a number of households near the training venue, speak to the household heads and ask them if you can conduct these assessments, and then go out together with your village health workers and do the activity as a demonstration. Looking at the household register, it looks very large and complex. It's important to remember though that most of this register across the top here is just a question of putting individual numbers or ticks and crosses, and that the answers that are supposed to be given are listed in the row around the indicator. So the first section of this relates to the household composition. So in terms of looking at the form, each row corresponds to one update visit. The bottom section should include all of the names of the household members living in this family. So for each visit, you would write the date, write the total number of household members, and write the total number of members in each of these categories. In this bottom section, we write the name, age and sex of each of the household members. In terms of registering births and deaths, these can be done at any time, but all the births and deaths within this time frame would be captured in these boxes below. This section here, from children aged 2 to 5 and all the way up to adults and sexual reproductive health, this section is encompassed in the family health check. So not only do we have denominators, which are the number of people in each of these categories, but we also have the uptake of key health practices for those family members. Remember that the register doesn't capture everything covered in the family health check. Registers only capture sentinel data that's important to monitor. The last section is related to the household assessment. So for the most part, this is just providing a tick that you've confirmed that those preferred health practices or health resources are available for this family. The last column here is to ensure that men in the household have been involved in this. As I mentioned previously, ensuring environmental health, men have a particular role to play there. The last section in the bottom corner is risk factors or concerns. So there are vulnerability assessments related to the financial vulnerability of the household and also to food security that are conducted typically at the level of community. But the village health worker can also identify any additional vulnerability factors such as adolescent pregnancy, HIV affected household or disability. It's really important to mention here that this register will be accessible to lots of people, so it's important not to record very personal information about people that does not wish to be disclosed. So things like HIV could be highly sensitive. Once you've compiled this register for all of the households, there is a community version of this that should be completed by the village health worker that consolidates all of the numbers into a single form. That means that at a glance, a community health committee or a district can know how many families or households within a village health worker's catchment area have particular needs, and for example, lack of access to improved sanitation, lack of water resources, or have issues with food security. Moving on to Unit 2, some of these concepts you have already covered earlier in this week related to timed and targeted counselling. So we won't go into much depth here in this session. Have a look at the Healthy Families Job Aid and you will see the following the following tables, which encompass the main points around, firstly, good effective communication styles, and secondly, around negotiating behaviour change using the what, why, what, how technique. So what I would like you to do is to take a look at Unit 2, Session 2 right now. So in that session, if you go to Activity 4, you will see that there is a practicum activity in which you're required to look at the family health card and use the family health card example to practice using negotiation technique. You should conduct a barriers analysis and find a solution using the example given. Pause the video now and get back to me when you've finished. So now let's move on to Unit 3, which is all around environmental health in the home. The module, which starts on page 56 and up to page 82, covers all the technical content that supports the assessment of WASH in the household. So this is quite a large section of your curriculum. However, the majority of the content described here is derived from older versions of the Village Health Worker manuals. You've covered some of this in your homework, and hopefully you are familiar with the content that's included in this unit. However, what I'd like to do now is just to review the Healthy Families Job Aid together, because that captures all of the critical information and job aid prompts that the village health worker are going to need to cover this section well. And then what I want you to do is to spend some time in your groups reviewing the module content. Just go through page by page and please identify new areas or issues that you've not been trained in previously and ask questions. So we're going to go through the activities related here. So as you can see, the whole of this unit culminates in the conduction of the household assessment. So particularly around safe water, we can see that we need to conduct an assessment of the water source, making sure that it's a protected water source, that it's an improved source of water, and that it's protected from waste disposal or animal refuse. Having a look inside the household, ask the family to see where drinking water in the home is kept. If they don't have piped water, is the water kept in a sealed container? Check the sealed container for any access to contaminants. In terms of safe drinking water, make sure that all water is safe to drink, especially for children under the age of 5. Ask the family to explain or show you how they treat water for drinking, and recommend the use of boiling, chlorination or solar disinfection. In terms of sanitation and hygiene, we start by asking the family to identify for us the hand washing facilities. We want to ask if all members of the family have access to running water and soap or suitable local products that can be used for hand washing. Ask them to show you where they wash their hands after using the latrine. Ask them to show you where they wash their hands before cooking. So we're hoping to see convenient hand washing facilities close to the latrine and close to the kitchens. If not, we recommend that the family construct hand washing stations, and we're going to show them how to do that. In terms of the improved latrines, we ask the family where they have access to a latrine that all family members currently use. We can ask specifically around avoiding open defecation, but we need to go and observe the type of latrine that they have, and we'll indicate on the assessment whether or not this is an improved latrine facility. If not, we will counsel the family on how to build or construct an improved latrine. The third section is around safe waste disposal, so we'll be looking at how they manage household waste if it is disposed of safely and hygienically out of the way from the people's home. Do they burn or bury their rubbish? Is the yard free of garbage? And do they use a compost heap? In all of these elements, we will teach them techniques for improving their safe waste disposal. So turn to the pages in your job aids that relate to water and sanitation. So the first aspect is to look at the F diagram and what are the routes of infection that can lead to diarrheal disease. We'll talk about why hygiene and sanitation matters and how we can block the roots of infection through hand washing, improved water disinfection, food safety, and also providing a protected play space that keeps children away from animals and For waste disposal, we'll be teaching families about how to construct disposal in their communities close to their home. We will explain to them why it's important to dispose of waste safely and how to build a safe refuse pit, and how and when and where to dispose of feces or nappies. Managing solid waste in the communities, we will also promote the 3R concepts, so reduce, reuse and recycle as much as possible. These are the instructions that are provided to help families to build a refuse pit. Making a compost heap. Compost is very good for families who have home kitchen gardens in particular. It's a great way of reducing the amount of household waste, particularly that waste that is biodegradable, and it will also support them to have access to a reliable source of manure after 6 months. In terms of ensuring families have access to improved latrine facilities, we will teach village health workers about the different types of latrines that they will observe, and also to identify unimproved sanitation facilities. So that's any flush or poor flush system that is not piped to the sewer, to a septic tank or to a pit latrine. We also encourage families to make sure that they don't have an open pit latrine and that can pose a danger particularly to children and are not safe. We'll also teach families about how to build and maintain a latrine, and preferred practices around menstrual hygiene and the disposal of soiled pads, which is particularly important in the event that we have an HIV positive client. Village health workers have a special role to play in caring for sick people at the home, including people who are disabled, elderly or undergoing palliative care. So in terms of sanitation for those people who are no longer able to control urinary, bladder or bowel movements, we will support them to use bedpans and to improve latrine access for those individuals. Keeping water safe. So first of all, we talk about preventing dirty. What are the sources of water that the household have access to that is their main source for drinking? So we're hoping that all families have access to piped water, public tap or standpipe, tube well or borehole, a protected dug well, protected spring, and if not, they have access to rainwater collection or bottled water. Water that is stored in a household needs to be carefully protected from contamination. Water can contain some invisible amounts of bacteria and viruses and parasites, and if the water is stored in a non-sealed container, people's hands, for example, can contaminate that drinking water, and that can cause diarrheal disease. So we'll promote these key messages, but we'll also conduct an observation in the family to make sure that we observe any containers where water is kept. And then following the use of the water, it should be rendered. So we promote the methods of chlorination, boiling and solar disinfection, perhaps only during the summer months within Lesotho. One of the most common sources of water in Lesotho is the protected spring, especially in the mountainous areas. So village health workers need to be competent to identify whether or not a spring source is protected, but also to support the family to build and construct the protection of the spring itself. And these are the step-by-step instructions for how to protect a spring. Food. So we'll talk here about the importance of food safety, but we also advise the village health worker to go into the family area where the kitchen, where the food is being prepared, and to make sure that the cooking area is clean. Observe and promote the following practices, which surround hand washing and washing and sanitisation of surfaces used for food preparation. Ensure that the handling of food is appropriate, so keeping raw meats and poultry and fish separate from other foods such as fruit and vegetables. All fruit and veg should be washed with clean water, especially if eaten raw, and that can also be washed using chlorinated water. Make sure all foods are covered to prevent flies and rodents from contaminating the foods. We'll promote the importance of cooking food thoroughly and making sure that they do not store unless they have access to a refrigerator. Hand washing facilities is a key practice of the village health worker to promote. So we will demonstrate how to set up a hand washing station close to the latrine and also close to the kitchen, and make sure you have access to that. There are other types of hand washing facilities that can be constructed, including the hole in the cap and the tilting jug. These are kind of tippy taps, which are really simple hand washing methods that can be constructed when a family don't have access to a tap. So, we've reached session 5, which is a safe and loving home. I would like you to conduct this session if time allows. Once you get to the last section of the session, you will work through the storybooks. This involves the negative story of Fuzi and the positive story of Likaleli. So now in plenary, what I'd like you to do is to read these stories aloud. Have one person on a flip chart take note of all of the actions that they see caregivers taking in the stories that might influence child's later development. Then you can go on to have discussions around the 6 questions that I've listed here. So, having identified those actions that can influence the child's development, perspective and aspirations, I also want you to discuss what does each child learn about relationships from their caregivers and how might that affect their own relationships in later life. Let's discuss the fathers. What did each father do differently, and what were the roles of the father in caring for the child? Fourthly, if you were to conduct a household visit, what differences might you observe between these two families? 5th question, what were the different communication styles of the families? And which of these creates a more child-friendly home? Lastly, it's important to mention that in these stories we hear the story from the child's perspective. So it's told in first person. TTC stories are always in the third person. This is deliberate because we want you to understand something about children's perception of parents' behaviour. So discuss in your groups, what do you learn from these stories about children's understanding? When you're ready to move on, let's review pages of the Healthy Families Job Aid. So in the household assessment, there are quite a lot of topics to be covered, and some of these are questions to pose to parents and some of them are observations to make. So starting with the concept of play and communication, we'll be asking parents whether all babies and small children have a space to play, have access to age-appropriate toys. Do both mothers and fathers spend at least 30 minutes a day doing one or more of the following activities? And this relates to our hug, talk, sing, play, read questions. But we also talk about making toys and playing with safe objects with the child. Second aspect is around positive discipline and child-friendly emotional environment for the child. So the question is, do parents avoid the use of physical or emotional punishments as much as possible? Are children and young people always praised for their good behaviour, remembering that positive reinforcement of good behaviour is much more effective at promoting discipline and good behaviour than punitive discipline? Is the household free of serious or chronic issues such as substance abuse, family stress and domestic violence? If you're concerned that the family have got issues of domestic violence, it's really important to promote that parents will buffer or protect their children from their disputes, just as the stories demonstrate. Do parents spend time every week to do activities with their children to relax and spend family time? And are all children and young people respected and involved in the family regardless of their abilities and their gender? The next section relates to the child's safe home. So we'll be conducting an assessment of the indoor play space and then of the outdoor play space. So we will ask the mother or father to indicate to us where the children spend most of their time, where babies are placed for indoor play. Especially if the children are walking already, then we need to make sure that that indoor play space is free of poisons, chemicals, alcohol or medicines. Any harmful objects such as sharp objects, farming equipment are out of reach. Electrical wires, electrical plug sockets, especially those that are homemade, need to be carefully covered. Sharp edges of furniture are often a source of accidents in the home. Animals should be kept in pens and not allowed to roam freely in the household. The floor should be swept and any small items that could be swallowed or choked on should be removed, reminding parents that children, especially under the age of 2, have a tendency to put things in their mouths. Then go outside and look at the outdoor play space where children are playing. We need to make sure that space is clean, hygienic and has adequate supervision from adults. Any farm influence or sharp objects should be out of children's way. Chemicals and toxic materials should be stored safely away. And then lastly, all families should have an emergency plan for if there is an accident. So this is just a quick recap of some of the things you should have looked at in the session. So the prevention of injuries and the different aspects of those prevention actions that need to be. This is an assessment of both the indoor space and the outdoor space. The types of activities and the importance of participation and play. Also, we've got some examples of simple toys that can be made at home, especially for children under the age of 2 that parents often don't know have a need to access to toys to play with. We'll talk about those key messages covering the freedom from violence, stress and abuse, the importance of emotional development and the role that toys have in promoting mental cognitive development. Here's the key message around protecting children from violence and abuse. And not forgetting to reflect on those barriers to child development and how damaging violence and abuse or mental health and depression problems in the home can have on a child. Also to mention that if we suspect neglect or abuse, village health workers should make an appropriate referral or discuss the matter further with their supervisors. So that's where we've got to now. Now it's time to have a break. And hopefully this afternoon we will cover the next section, which is health for the whole family and sexual reproductive health.